Hey, Dr. Osborne here in the Gluten-Free Society newsroom. Right now, everybody's all about COVID-19. It's all you hear about, it's all you read about, the internet's buzzing. It's the #1 searched Google term ever. And so I wanted to provide you with some news research updates today because a lot of you are nervous and scared, especially if you've got loved ones who are sick or loved ones who are at risk for becoming sick. But I want to talk a little bit about vitamin C today. One of the things that we're hearing, about COVID-19 is that, of course, there are no known treatments. There are no known, really anything that doctors can do right now that are proven successful in the treatment, mitigation, or prevention of COVID-19. You hear talk about, malaria drugs, antiviral drugs, and some experimentation with some of those things. But one of the things that we're really seeing, in my opinion, that's on the forefront of this is vitamin C therapy. Now, in the New York Post just published an article, and you guys know I'm not the biggest fan of the New York Post, and I was super happy to see that they're actually posting information like this because they've already tried to deface some of our articles and videos about vitamin C. But here recently, the New York Post published an article on how doctors in New York City are using high doses of vitamin C intravenously for patients as they're coming into the hospital being diagnosed with COVID-19. As a matter of fact, Dr. Andrew Weber, and kudos to you, Dr. Weber, for having the courage to stand up and use vitamin C and demand that your patients get the best from what research knows to date. But this is a quote from Dr. Weber. Dr. Weber said, "The patients who received vitamin C did significantly better than those who did not get vitamin C. It helps a tremendous amount, but it is not highlighted because it's not a sexy drug." Look, everybody's talking about these anti-malarial drugs. What nobody's talking about are the severe side effects that those drugs can create. Vitamin C is super safe, and according to Dr. Weber, it actually it's having better outcomes. The patients are having better outcomes. So what are they doing? Coronavirus patients in Dr. Weber's care are receiving 1,500 milligrams of IV vitamin C the minute they get their diagnosis. But then subsequently, they're getting 3 to 4 more doses per day of 1,500 milligrams of intravenous vitamin C. That speaks volumes because most of your infectious disease and emergency physicians are not going to use something. They're not going to waste resources on something that doesn't work. Now, where is this coming from? Where's this vitamin C use coming from? I want to share with you where some of it's coming from. So this is a study. I'm going to put this up on the screen for you, but vitamin C can shorten the length of stay in the ICU. So this was a meta-analysis done. So this was a study of studies that was performed and published recently in the journal Nutrients. So this was just published a few months ago. And so I'm just highlighting. In 6 trials, orally administered vitamin C. Now hear what I'm saying. Orally administered vitamin C, not IV vitamin C, but orally, meaning you take vitamin C through the mouth, right? So orally administered vitamin C in doses of 1 to 3 grams per day reduced the length of ICU stay by 8.6%. That's phenomenal. That's a phenomenal outcome, reducing the stay in the intensive care unit by 8.6%. Look, one of the reasons right now everybody's so nervous when we're trying to flatten the curve is so we don't overwhelm the hospital. Look, if we can get people out of the hospitals quicker by reducing their stay with something as simple as the use of vitamin C, which is very inexpensive to do, why wouldn't we? Why wouldn't we, in order to help those doctors and those first responders by taking some of that burden? And so that's what this study is showing, is that in 6 trials, oral administration of 1 to 3 grams a day of vitamin C reduced ICU stay by almost 9%. Now, in 3 trials in which patients needed mechanical ventilation for over 24 hours, vitamin C shortened the duration of mechanical ventilation by 18%. This is a huge number, folks. It's almost 20%. Giving the insignificant cost of vitamin C, even an 8% reduction in ICU stay is worth exploring. So again, this is a meta-analysis just published a few months ago in the journal Nutrients. It's a meta-analysis, is a study of lots of studies that show that vitamin C orally can reduce ICU stay by almost 9%, and that vitamin C can also reduce the length of stay in the hospital for patients who require ventilation by almost 20%. This is a big finding, and one that's not or shouldn't be ignored, in my opinion. Now, we also have this release. This came out of from a site, one of the world leading authorities in nutritional medicine called Orthomolecular Medicine, and you can find that website at orthomolecular.org. They're a wonderful site. But here's a press release they just issued on vitamin C. Here's what they say. Early large dose intravenous vitamin C is the treatment of choice for 2019 nCoV pneumonia. In essence, it's the treatment of choice for COVID-19 pneumonia. So patients who are getting pneumonia from the coronavirus, from this novel coronavirus, these doctors issued this press release saying that vitamin C should be the treatment of choice. They go on to say, we call on those in leadership and those providing direct assistance to patients to bravely and rapidly apply large doses of intravenous vitamin C, IVC, to help those patients and to stop this epidemic, and at this point, this pandemic. So what these doctors also say, and the reason why they say this is again, this is their press release and this is based on their opinion. Some of these doctors are the doctors that are doing the research on vitamin C in China right now on COVID-19. And some of these doctors are some of the world leading experts in IV vitamin C therapies. But here's what they say about IV vitamin C therapy. Increased oxidative stress and underlying cytokine storms. So if you've been reading about cytokine storms, those are the chemical releases that occur inside the lungs of people where the virus is starting to take control, and it creates a severe pneumonia and a severe inflammation in the lungs that virtually drowns these patients. This is how they die. But these cytokine storms lead to ARDS, acute respiratory distress syndrome, which is the key pathology of high mortality of these pandemic viral infections, meaning that the way that people are dying from COVID-19 is by developing acute respiratory distress. And so what we have is we have research that shows that vitamin C helps patients with acute respiratory distress. Now, there aren't any studies on COVID-19. I know I've said this before, and I'll just clarify it again. There are no studies that have been published at this point that are tried and true in COVID-19. There are preliminary studies, there's preliminary data. I'll show you some of that. And there are the doctors who are on the front lines that are reporting the benefits. And I want to share this with you because I want you to know if you happen to have a loved one in the hospital or if you get hospitalized yourself, you need to be asking for vitamin C. You need to be demanding it. And I'm going to show you how you can get a resource for that here in just a moment. So, look, we keep hearing this. There is no treatment for COVID-19. However, the evidence that's coming out, the doctors who are on the front line that are doing the treatment are using vitamin C. Why are they using it? According to them, they're using it because it works, because it's providing better outcomes. We also have research studies that show that vitamin C orally and intravenously provides better outcomes in hospital stays and in patients who are on ventilation. Again, maybe it's not COVID-19 as the cause, but we have this scientific body of evidence that shows that vitamin C can be beneficial in pneumonia, can be beneficial in that ICU room, and we need to think about how to implement this, how to interpret that and implement that in an actual setting, because again, there are no known effective treatments for this right now, and we have to do everything we can to try to save these people in these hospitals. Now, the government, if you go to clinicaltrials.gov, you can look at this, and I'll put it up here for you. I'm going to read from a quote of one of the trials that's ongoing right now on vitamin C therapy. This is a trial that's going on in China as we speak. Vitamin C, this is what the authors of this study wrote. Vitamin C, also known as ascorbic acid, has antioxidant properties. When sepsis happens, sepsis is infection in the bloodstream. So when sepsis happens, the cytokine surge or storm caused by sepsis is activated, and neutrophils in the lungs, meaning a type of white blood cell in the lungs, accumulate in the lungs, destroying the capillaries. Early clinical studies have shown that vitamin C can effectively prevent this process. In addition, vitamin C can help to eliminate fluid by preventing the activation and accumulation of neutrophils and reducing alveolar epithelial water channel damage. In essence, it's helping to prevent the fluid from building up in the lungs and drowning people in their own fluids. At the same time, vitamin C can prevent the formation of neutrophil extracellular traps, which is a biological event for vascular injury caused by neutrophil activation. Vitamin C can effectively shorten the duration of the common cold. So this is, again, what I'm reading to is a quote from the Chinese researchers that are actually on the ground right now in Wuhan doing the studies on intravenous vitamin C for the treatment of COVID-19, for the reduction of symptoms and the improvement of outcomes. Then we have this other research. So I'm going to present some other research, some other trials that have been done that show the effectiveness of vitamin C. Again, not necessarily in COVID-19, but in other viral infections. So in this particular paper that was published in the journal Nutrients on vitamin C and infections, 2 controlled trials, and I'm quoting here, 2 controlled trials found a statistically significant dose response for the duration of common cold symptoms with up to 6 to 8 grams a day of vitamin C. What does that mean? That means there have been a couple of studies that have found that people that take 6 to 8 grams of vitamin C reduce their duration of being sick. Now, why is that important to understand? Here's why. There are some studies that have been published, and I hear people in the media talking about some of these other studies where they say vitamin C is not effective or vitamin C doesn't help. Here's why. The dosing of some of these other studies was nowhere near enough to be therapeutic. You have to remember that when we're talking about colds, flus, viral infections, it's not about the daily need for vitamin C anymore. The daily need for vitamin C is less than 100 milligrams. Here, we're talking about studies that show the benefit at around 6 to 8 grams a day, which is a lot higher than 100 milligrams. We're talking about 60 times plus the dose. So if studies are being done where the dose is not high enough, of course we're not going to see the benefit. Of course we're not going to see the outcome of positivity. In studies, though, where there have been high dose or therapeutic doses of vitamin C use, we do see positive outcomes. And I want to share that with you because there's a lot of naysayers out there that are poo-pooing vitamin C as an ineffective modality and something you shouldn't waste your money on. And I've even heard some doctors, there was one irresponsible doctor who had no training in nutrition whatsoever, and Fox and Friends had him on one morning a couple of weeks, I think it was last week, where he said that actually that taking supplements could increase the risk of developing autoimmunity. Now that tells you what kind of a moron this man was, because there's no scientific evidence at all that says that taking vitamin supplements is going to increase your immune system, therefore causing autoimmune disease. It's a preposterous statement to make. And I just want to clarify, dosing matters. And so with vitamin C, again, this research study proves that dosing matters because other trials that have, again, used 3 grams or less showed less benefit. So you have to understand that the dosing matters. Now, in this next study I'm showing you on vitamin C and immune function, published again in the journal Nutrients, you see these are some of the functions of vitamin C. So that if we just think about what vitamin C does in the human body, I want to share with you some of these functions so that you can understand them. Vitamin C is shown to enhance differentiation and proliferation of B and T cells. Now, these are specialized types of immune cells that help you to produce antibodies, but also to help you protect pathogens like bacterial and viral pathogens. Vitamin C deficiency results in impaired immunity and higher susceptibility to infections. We know that. That's been very well studied. This is why there's also mixed reviews in some research studies, because when people who have impaired vitamin C levels take vitamin C, we see greater responses in studies. We see greater outcomes. When people go in and maybe in a clinical trial and people get vitamin C, but maybe their vitamin C levels aren't low, we don't see as good of a benefit in those individuals. We see the benefit in the people who actually have active vitamin C deficits. Look, that's America. The American diet is vitamin C devoid. How much vitamin C do you get on a regular basis? How many fruits and vegetables and high vitamin C rich foods are you eating on a regular basis? The average American doesn't get much. And then when you add to the fact that certain medications deplete vitamin C, drugs like ibuprofen can deplete vitamin C. When you add to the fact that processed foods and alcohol can deplete vitamin C, the average American is really struggling to get adequate quantities of vitamin C. So we know that vitamin C deficiency results in impaired immunity and higher susceptibility to infection. We also know that infections significantly impact vitamin C levels, okay, due to enhanced inflammation and metabolic requirements. So in essence, the damage that's being caused, the inflammatory damage that infections cause, suck the vitamin C right out of your body. So not only do we know that low vitamin C or vitamin C deficiency increases your risk for susceptibility, but we know that once you do get an infection, that your body requires more vitamin C because the inflammatory damage from the infection is burning through your existing vitamin C in a greater fashion. So that being said, furthermore, supplementation with vitamin C appears to be able to both prevent and treat respiratory and systemic infections. Again, that's not me saying that. This is a quote directly coming from this study that was published out of the Department of Pathology at the University of Otago in Christchurch, New Zealand. So, treatment of established infections requires significantly higher gram doses of vitamin C to compensate for the increased inflammatory response and metabolic demand. So again, vitamin C has been shown to be effective at helping reduce the symptoms and helping reduce the duration of colds and viral infections. Again, it hasn't been studied in COVID specifically, but other types of infections it has been. We know that if you have a vitamin C deficiency, that you are at greater risk for infectious susceptibility. Number 3, we know that if you have an infection, your body will use up more vitamin C to help fight the inflammatory damage from the infection. And number 4, we know that the treatment of established infections requires significantly higher doses of vitamin C, meaning you can't just throw 500 milligrams at a major infection and expect to see a positive outcome. The dosing structure, as I showed you in some research studies, shows that it's 6 to 8 grams a day. In another study I showed you that it was oral doses at least as high as 3 grams a day. So you can't do a 500 milligram vitamin C tablet and expect to get great results or expect to have great things happen. The dosing, according to research studies, is much higher than that. So again, I wanted to share all that information in this breaking news update with you because doctors on the front lines are now seeing the value of vitamin C. They're starting to implement it within their patients, and the outcomes for people with COVID-19 are improved out of the words of the doctors on the front line. So if you happen to know or have a loved one that's in the hospital, if you happen to come down sick, what I'm going to do below this video is I'm going to post a link to orthomolecular.org's website. Again, one of the world-leading authorities, this website, one of the world-leading authorities in orthomolecular medicine, which is nutritional medicine, where they actually have a vitamin C protocol that doctors in the hospital can use. So it's written in a language that doctors will understand, and I'm going to post that link to you just below this video so that you can have access to that. And share it with the doctors that you know, share it with friends and family, and make sure we can get this information out there, because if Dr. Weber's results are replicated across other cities across the U.S. and the world, then part of what we can potentially accomplish with this information is reducing the duration that these people need to be in the ICU, reducing the time on ventilation, and potentially even saving their lives. This is Dr. Osborne, caring for you always. We'll see you in the next news update. Stay safe.